Hello, my name is Dr. Srikanth V. Breast augmentation is a very seriously hot topic right now. There are a lot of questions that people like to know, which is better for them, whether is it the implant that is better for them or is something known as a fat transfer, that is a lipo injection that is better for them. Now, you need to understand the basic difference between an implant and a fat transfer. Now, both of them will increase in the size of the breast, but implant does it by putting a silicone implant, that is a foreign body, inside the breast tissue, and that increases the size of the breast. Whereas in a fat transfer, the patient's own fat is taken either from the abdomen, thighs, inner thighs, outer thighs or buttocks or all the places and is filled into the breast to give it a bigger size. Now, a few things you need to know about the differences between this implant and the fat transfer. If you are looking for a significant augmentation, then implant is the right way to go. However, if you are looking for a mild to moderate increase in size, then the fat transfer is the better way to go. The second thing that you need to know is, if you do not mind having a foreign body inside you, then implant is the better way to go because it is more predictable, it gives you a better shape and it gives you the size that you desire. However, if at any time in your life you feel that you do not want any foreign body inside you, then you should probably opt for the lipofill or the fat injection, which will give you an augmentation within its own specified limits. When it comes to breast augmentation, there are two main types of ways of doing it. One is a plastic surgeon will put in an implant inside you, or he will take fat from one part of the body and transfer it into you. Now, the first one is known as a implant-based augmentation. The other one is known as a lipofill-based augmentation. Now, in the implants, there are different types of implants. There are saline implants, there are silicone implants, there are anatomical shaped implants, and each one of these has a different way of functioning. Now, a saline implant basically is an empty bag. It is inserted into beneath the breast or beneath the pectorals, wherever your surgeon decides to put it, and then it is gradually filled with saline. Now, saline expands the implant and it gives rise to the augmentation. The advantage of this is that through a small opening or a small port, you are able to insert a big expander and it gives the desired expansion. However, there is always a concern that over a period of time, the saline implants may degrade and the saline may leak. On the other hand, a silicone implant, the current generation of implants that are available right now are memory-based gel implants, so that to insert these implants, we probably need a slightly bigger incision. When I say bigger incision, it probably might increase by about a couple of centimeters or so. But we are able to place the implant in the correct plane, in the correct place and the correct position. And these implants have a longer life than a saline-based implant. So these two are about the implant-based reconstruction. Whereas in a fat transfer, what we do is to harvest fat in different volumes, maybe 150, 200, 250, 300 cc's of fat. It is processed in such a way that it can be injected into the breast, and this is injected into different parts of the breast to fill up the volume of the breast so that you get a augmented breast. Now, are gummy bear implants safer or better? Now, gummy bear implants basically refers to a silicone implant which has got a memory gel inside. Now, the reason this gummy bear term comes is that it is like a way of explaining how these implants are. So, even if these implants rupture or they are cut, they tend to maintain their shape similar to these toy gummy bears, which are also made of similar kind of material, which retain the shape even in the event that they are damaged, if not now, sometime in the future. So yes, gummy bear implants or memory based implant, silicone gels implants are better and probably safer and will probably last you a longer time than a saline filled implant or a non-memory gel filled implant. Now, whenever somebody comes to me for an augmentation, they always have this question in mind. They are going to undergo surgery, they are going to spend some money on the implant. So how long will it last? Now, we must tell you that today we are in the generation era of fourth generation implant. That means implants have gone different generations, different changes, and we are in the fourth generation. Here, the implants have got a silicone membrane or a polyurethane membrane. It is filled with silicone gel, which has got a memory, and this memory stays even if the implant capsule is ruptured. These are supposed to last for at least 15 to 20 years. Beyond that, we also don't know. We are also learning. Sometimes it can happen that these silicone implants rupture and leak out. But then, as far as the companies go and as far as the technology and the research go, they tell us that anywhere up to 15 to 20 years and above is what you can expect the life of an implant. When it comes to breast augmentation and somebody counseled about breast augmentation, we tell them about breast implants and fat injection. Now, fat injection is something that the patient's own fat is taken out. It is taken out from the abdomen, it is taken out from the thighs, either the inside, the outside, sometimes the buttock, and it is filled into the breast to fill up the volume. Now, is it more safer? Yes, it is more safer because there is no foreign body in you. The chances of infection are very low, and usually these are the people who would have a body habitus where they would like to get rid of the fat from these parts of the body. So you get an added advantage of having a liposuction in the different parts of the body. However, you must know one thing. The science today has not taught us how to guarantee you the results with the lipofill or the fat injection. In certain percentage of the population, this fat tends to get dissolved and disappear. So initially you may have a very good appearance, but over a period of time, about a few months, you may feel that the breast has become smaller because it is unpredictable in it, what we call as the take of the fat graft. So there is a possibility that you may have to repeat this procedure again so that the desired volume is maintained. This is something that your plastic surgeon can explain to you after examining you, after estimating the size of the augmentation required and availability of the donor side, that is the abdomen, the inner thigh, the outer thigh, the buttocks. All this will give an idea how much fat can be filled. Now, uneven breast is a problem. It is more common than we think, but people don't come forward to talk about it because on one side the breast is completely normal, other side the breast is hypoplastic, that it is small, or amastic, that means it is not developed at all. Can this be treated with augmentation? Yes, most definitely. But what I have seen in my practice over this very many years is people come to us when the breast difference is really large. That means the breast one side is bigger, it is ptotic, means to say it sags down, and then they come for an augmentation. So with an augmentation, you must remember that it can never match the fall of the normal breast. It can give you fullness when you're wearing clothes and undergarments, but otherwise you can make out the obvious difference between an augmented breast and a natural breast. The best way to treat this difference in symmetry is to undergo procedures on both breasts. That is, on the side which it is small, you put a breast implant. On the side which is big and which is sagging down, you lift it up with what we call as a mastopexy. When we do both combined together, you will find that the breasts are more symmetrical and give a more pleasing look. People gaining more and more experience with both natural augmentation, that is lipofill, and silicone based implants, we find that there is a certain set of patients, a small segment, who benefit with both. That means you fill in fat to different quadrants of the breast, and over and above that you put in a breast implant. Now, the breast implant will give you the desired volume. The fat injection will take care of the places where the implant does not appear to fill up. It is a possibility, but however, it should be done in carefully selected patients, and it is my suggestion that you discuss this with your plastic surgeon before you commit yourself to undergoing a composite breast augmentation.